Hello, this is Dr. Tamer Seckin in Bari at the 17th annual ISGE meeting, Women's Health from Diagnosis to Treatment. I am with Dr. Ternamian, Artin Ternamian from Toronto, Canada. He has been very well known in the ISGE circles and around the world with his contribution to the laparoscopic work, his guidance towards complications and preventing them. We will focus today not generically on the complications, yet not on the overall philosophy behind complication, how it relates to the social and the politics of medicine, the healthcare, and he will look us. We're going to wind the tape backwards, and he will give us a backward look how the complication relates to all. Artin, it was a beautiful presentation today, and I really want you to go back. We know what happens in the OR. We know what we survived through, and it's always the doctor that's been implicated, yet the hospitals and the big industry, things do pass without being reporting to the right channels, and we never progress. And I want to take the microphone and really go and work on this in the next 5 minutes. Inner thoughts.
Sure.
With your experience, layer by layer. Thank you.
All right. Listen, the presentation today, or the session that we had, dealt with complications of endoscopy in general terms. There were people who presented and talked about laparoscopic complications specifically, and other people talked about hysteroscopic complications. And my contribution at the end of that session was to talk about risk awareness. And as I was telling you a minute ago, risk awareness was a term and a concept that I was not introduced to as a resident, neither were you, I'm sure. But this idea developed over the last decade or so, since healthcare, particularly in the US and in Canada, encountered celebrated cases. By that I mean terrible disasters that were well publicized that affected my patients and your patients. And these celebrated cases raised awareness among healthcare professionals, among government officials, and insurers and industry to the fact that